Our next speaker is Dr. Wei Xu from the First Affiliated Hospital of Nanjing Medical University. Dr. Xu is the secretary and also the key member of our CwCLL. Her topic is the overview of CwCLL work. Welcome.
Good afternoon, the Chinese experts, and good morning, the European professors. I'm Wei Xu from the First Affiliate Hospital of Nanjing Medical University, Jiangsu Province Hospital. It is my great honor to have this opportunity to give a brief introduction of the CwCLL work. I will deliver this talk with 3 parts, including the growth journey of CwCLL, achievement of 2020, and plan for 2021. Firstly, I would like to give a brief introduction of the growth journey of the CwCLL. The Chinese workshop on CLL was founded in 2017 with the purpose to standardize the diagnosis and the treatment of CLL, foster the Chinese CLL specialized clinicians, and also aim to promote CLL-related research. We have 3 missions. The first is building the International Advanced CLL Center. The second is promote a standardized of diagnosis and treatment of CLL. And the third is promote an overall academic level of CLL. For now, there are 7 core members in CwCLL, and they are the Chinese authorities in the field of the CLL. And besides, we also have the 82 community members as well. Here, I would like to share with you the work we have done. The on November 10, 2017, the CwCLL founded in Nanjing, and we hold a first CwCLL meeting. And in 2018, the CwCLL successfully published the Chinese CLL guideline, and it truly helps the Chinese hematologists in the diagnosis and treatment of CLL. And on November 3, 2018, we hold a second CwCLL meeting in Nanjing. And in 2019, we kicked off the CLL real-world study. 15 CLL Center of Excellence Hospital were awarded also in 2019. And on the November 15, in 2019, we hold the third CwCLL meeting in Guangzhou. And in the CwCLL annual meeting and organized various types of medical education conferences. More than 4,000 hematologists were educated online or offline. And in 2019, we set up the first Chinese College of CLL, which plays a big role in the COVID-19 pandemic. In the extreme difficult 2020, we also continue our work and keep on growth. We hold 9 online courses of Chinese College of CLL from the March to the May in 2020, even though the pandemic is serious, and we still focus on the standardized of treatment. And in the second half year of 2020, we established 16 local workshops to close the cooperation with CLL specialized clinicians. However, we still have a long way to go, and we're looking forward to cooperating with IWCLL in the future. Secondly, I would like to introduce the achievement of 2020. In the 2020 CwCLL work, including 3 parts. First, the Chinese College of CLL online course from the, March to the May of the 2020. The Chinese College of CLL online course is an education project, a serious online course for the clinicians and lab experts to discuss the management of patients with CLL. The objective is to increase the physician's awareness of the need to test the prognostic factors in all CLL patients requiring treatment in order to select the most appropriate treatment for the patients, and help the hospital to standardize the techniques and improve the dictation rate, and also foster more CLL specialized clinicians and promote CLL-related researches in China. Because of the outbreak of COVID-19, CwCLL quickly launched a CLL standardized diagnosis and treatment online course. From the March 7 to May 30, every Saturday online, live online, totally 9 sessions. The topic contained CLL diagnosis, prognostic testing, treatment, efficacy assessment, consensus and guidelines, patient management, and related lab technology with in-depth explanation and discussion. The participation rate and effect of the online course are very excellent. The average watching time is 54 minutes, up to the 55% of doctors watching more than 30 minutes, according to the survey on the cognitive rate of the participant before and after the meeting. The clinician's diagnosis and treatment concept had been improved to a different extent. At last, we did the Chinese College of CLL online course final assessment, and finally, 202 CLL specialized clinicians got the certificate. Secondly, I would like to introduce the established local CLL workshop from the August to the December in the 2020. China has a 34 provincial administrative region, but the diagnosis and treatment of CLL are uneven. 16 CLL local workshops established in with the 243 hospitals. With the work of a local workshop, we can work more closely and efficiently. Thirdly, I would like to introduce the results of the real-world study of the CLL versus SLL in our hospital, Jiangsu Province Hospital Single Center, in the 2020. Before that, I would like to introduce the current situation of the diagnosis and the treatment of CLL in China. The mobility of the CLL in China increased with the expansion of the age population. With the late start of a standard diagnosis and treatment, as well as the systematic research of CLL, the China still lag far behind the advanced international levels. As for the diagnosis, the flow cytometry analysis is poor, and only a few centers can conduct a systematic genetic examination and the prognostic assessment. Not enough attention is paid to the treatment indications, poor standardization of treatment, non-availability of the new drugs, and lack of the long-term follow-up. This slide showed real-world data of the CLL or SLL in our hospital, Jiangsu Province Hospital, in 2020. An overview of 583 CLL or SLL patients who had visited our hospital in 2020. All patients tracked back to the earliest available records. The age of this patient, the median age, is 59 years old, which is much younger than that of the European CLL population. and 50% of patients range from the 51 to 65 years old, and 64% of patients are male, and the 87% of patients diagnosed as a chronic lymphocytic leukemia, and 12% of patients diagnosed as small lymphocytic lymphoma, and 71% of patients were treatment naive. 18% were relapsed or refractory patients when visit our hospital. The other are under the treating or have complete treatment. The majority of the patient, more than 19% of patients, had a ECOG score 0 or 1. And the hypertension and diabetes are the top two comorbidities of these patients. These slides disclose demographic and clinical characteristics among treatment-naive and relapsed or refractory patients. As for the age, there is not a difference between the treatment-naive or relapsed patients. The proportion of the late stage or benign stage of the treatment-naive patients are equally distributed, while for the relapsed or refractory patients, more than 50% of patients are in the advanced stages. The more relapsed or refractory patients had a higher CLL IPI score compared with the treatment-naive patients. This slide shows the results of FISH IGHV mutation status and the next generation sequencing among treatment-naive patients and relapsed or refractory patients. The most frequently most frequent cytogenetic operation are 13q deletion, both in the treatment-naive and relapsed or refractory patients, followed trisomy 12, 11q deletion, and 17p deletion. Only 5% of patients found detected with 70p deletion, while for much less than that patient with in the relapsed or refractory patients, 15%. As for the IGHV mutated status, we found that the treatment-naive patient more likely to carry the IGHV mutated gene than the relapsed or refractory patients. Here displayed next generation sequencing results, analysis results. The most frequently mutated gene are the MYD88, LOTCH1, TP53, KMT2D, SF3B1, IGAL5, FET1. And TP53 mutation indeed are more frequent in relapsed or refractory patients. This slide showed the first-line treatment and response among the treatment-naive patients who made a treatment indication. The anemia, thrombocytopenia, night sweat, and the progressive lymphocytosis are the most frequently recorded the indication of treatment. And 21% of patients received ibrutinib monotherapy, and nearly 12% of patients received FCR regimen as a first-line therapy. 6% of patients received the FCR regimen therapy. The CR rates of the first-line treatment is 23%, and 56% of patients achieved partial remission. At last, the plan for 2021. One word to summarize the CwCLL work in the 2021 is standardization. We want to standardize the CLL treatment in all local workshops. Emphasis and debate the standardization through the CLL standardized case computation among the all member units. The standardization contains three aspects. The first is the standardization of diagnosis. differential diagnosis. The second is the standardization of the indication of treatment. And the third, the standardization of the choice of the treatment. The second work in the 2021 of CwCLL is cooperation with CwCLL. The Chinese workshop on CLL and international workshop on CLL were successfully communicated in Edinburgh during CwCLL biennial meeting in 2019. The objective of this meeting is to let CwCLL community know the current situation of CLL in China, and CwCLL seek the cooperation and support from CwCLL. In the 2021, we will have the deep cooperation with CwCLL in the education and the research of the CLL. And the CwCLL will also apply to host the CwCLL biennial meeting in China, maybe in the 2033 CwCLL biennial meeting. And we hope the COVID-19 pandemic will end as soon as possible, and we can communicate it face to face, and we will for the cooperation with international experts. And we sincerely welcome the international experts to come to China. And I promise that our Asian history, the pictorial the landscape, and the cultural experience will impress you. We believe with efforts of all of us, we could promote the development of CLL diagnosis and treatment and relieve the patient from the suffering. That's all for my presentation. Thank you.
Thanks, Dr. Xu gave us an overview of the CWL work and also shared us the real-world data from her center